A new report from the Commonwealth of Virginia says mental health hospitals are suffering from a lack of nurses. WSLS 10's Tommy Lopez went to Catawba Hospital, which is benefiting now from an increase in funding, but still battling the staffing challenges.
That report comes from the State Department of Behavioral Health. It says that many hospitals in the state are much worse off than Catawba. Some are even only at 40% of their potential nursing staff. Now, Catawba, as we've reported, is about to get some more funding, and leaders tell me today that they're really excited about that.
It's great. We've been fighting for that, asking for that for a number of years.
WALTON Mitchell is the director of Catawba Hospital, which has had 80% of its potential nursing staff this spring. The hospital is close to hiring more, and the new funding will make room for 10 more positions starting next week.
We have made it, and the department has made a number of efforts in the past year to help with recruitment and retention of nurses.
He says giving incentives like signing bonuses is important. Delegate Joseph YOST agrees. He fought in the General Assembly to keep the hospital open when there was talk of closing it down. Now the funding hurdle is clear.
The other bigger challenge is actually trying to find people to take those positions.
He's on a subcommittee that studies mental health. He says Virginia is looking at partnering with RN programs across the country and even internationally to bring in candidates.
But it's not just the mental health system. You know, all healthcare professions in the Commonwealth, you know, regardless of where you are, there's lapses in service because there's not bodies there to fill.
It's not just a problem Virginia is trying to solve.
Certainly, I think these efforts will help with that. Nationwide, there is a nursing shortage. It's not just us, it's not just Catawba, it's not just the Commonwealth of Virginia.
Radford University faculty member VICKI BIERMAN teaches future nurses the complexities of behavioral health. She says every nurse needs to have an understanding of it.
Because you can't get away from it.
She says our healthcare system needs to improve for nurses like her to help the most people.
For me, I think it's a right for all of us to have health care, and we're not providing that.
Everyone I talked to today agreed that there just aren't enough nurses graduating from programs across the nation, and that's going to continue to have an impact all over the country. In Roanoke County, Tommy Lopez, WSLS 10.